So your FY2 in surgery patient is a final year medical student has come to you because of feeling anxious. Talk to her, address her concern. That's the main thing. So general anxiety disorder. Our mnemonic for it, watchers. So how you gonna differentiate it from depression? Obviously, you can ask questions about depression as well. Depression is mainly, you will see low mood. This is not low, it's mainly of anxiety, more of anxiety in general anxiety disorder. So here you will see, you will feel low mood. Patient will have anhedonia. That is the main thing that you usually see. And you have got lack of concentration as well. So these are the things that you will see, right? So mainly low symptoms. Anxiety is more of anxiety, anxious feeling, not low. They're not low in general anxiety disorder. Before you say that you may have general anxiety disorder, we need to have a bit more history, long history. Usually a few months history you need, 6 months maybe history. It's a bit chronic history. For depression, if a patient is feeling low, and if I've got history of even 2 weeks, more than 2 weeks, I might be able to diagnose the patient with depression. Why I'm explaining it here? See, one of the main differential here, you have to go with this depression as well. But there is a slight difference between what is GAD and what is depression. Depression mainly depressed symptom, low mood, not able to concentrate, not enjoying things. That's what you get. And the history is maybe very much like, say, 2 weeks, 3 weeks, so we can diagnose depression. But for general anxiety disorder, you need more time. You need like 6 months history. Then only you might say you may have a condition called general anxiety disorder. The treatment is more or less the same, but we need to get the diagnosis. So these patients, they're worried about something. They feel they have anxiety when they have to do some particular thing. And because of this tension, they just feel the whole body, the muscles are stiff, tension, headache, band-like headache, neck stiffness, everything they get. They have problem in concentration as well. Their threshold is very less. I mean, threshold in terms of the irritability threshold is very poor. They get very, they get irritated very easily. They don't have energy. They just feel malaise, tired, right? Restlessness and sleep problem is there. So you see lots of things. A lack of concentration, sleep problem is there in depression as well. But depression mainly comes with low symptoms. That is something that I want to clarify here. So what happens? What happens here? How can I help you? Doctor, I feel anxious and I get tremors when I try to do the procedures in the hospital. So when I try doing some procedure, I feel anxious. That's the main thing. It's not feeling low, feeling anxious. How long you been having? It's been happening for past few months. Sometimes this patient is giving the history for 7, 8 months as well. Sometimes giving the history for 1 year as well. Then how it has affected your daily life. I feel less confident at work and I've got trouble in focusing as well. Over the past few weeks, how often you felt anxious? Quite often, especially when I'm doing a procedure. Do you find it difficult to control your thoughts? Yes, I can't stop thinking about the procedure and it makes me more nervous. Have you experienced any physical symptom like restlessness, fatigue, trouble sleeping due to anxiety? Yes, I've been tired a lot, sometimes can't sleep at night. So with this question, obviously I've asked many questions here and I would like you to ask one question at a time. That would be much, much better, right? And obviously, you can ask the problem with the concentration as well. That is the main thing, right? And now, in these kind of station, what you need to do, you need to rule out some things as well. So this patient is feeling tired. This patient is feeling anxious as well. This patient is a female patient. So what comes in your mind? What are the medical things that comes in your mind? That is, one is thyroid. That is the main thing. Because of female, young female, I definitely have to rule out thyroid. So ask questions about thyroid. Ask questions about diabetes as well. And in the later part of the station, There's no harm if you would like to check the blood sugar of this patient, or you would like to check for thyroid function test as well, right? Quick depression screening. How's your mood? If you're enjoying things you used to enjoy before, sleeping, eating, we have already asked. Ask this question, ask this patient about the suicide. I mean, if you feel when sometimes some people feel low, they just try harming themselves or try harming others. Have you ever thought of doing the same? No, doctor, this is not something there in my mind. So all these things you can cover. All right. So, and then, as I said, general physical vitals, and you can go for some investigation, and that includes the random blood sugar and thyroid function test. Okay. So, based on what you told me, you're experiencing generalized anxiety disorder, which is quite common, especially high stress environment like the medical school. It is a condition where excessive worry about various aspects can become overwhelming. It's not a weakness, and there are the effective ways we can manage it. So the treatment, as I said, whether it is GAD, whether it is depression, the treatment is the same. It is CBT. It is one of the most effective treatment for anxiety. It helps to understand and manage your these anxiety things, right? And if need to, we can. So what we can do, I can refer you to the therapist, and they'll be able to manage it in a better way. Now, depression, when we talk about what is the treatment of depression, CBT plus to manage depression, what we do, we have to have a very good lifestyle as well. So we always say if a patient has got depression and if he's smoking, you need to talk about no smoking. If they're drinking alcohol, no alcohol. And not a good diet, so encourage them to have good diet. And you encourage the patient to be physically active. You know, if a patient is having mild depression, for example, and if they are physically active, they started going for regular walks and gym and all, they started feeling better actually. Same thing here as well. So what you need to do is you need to talk more on the lifestyle thing, regular exercises, practice relaxation techniques, yoga, healthy diet, regular sleep, and limit your caffeine and alcohol intake. Same thing. So what you need to do here in this scenario, you need to take detailed lifestyle history about smoking, alcohol, diet, physical activity, whatever negative you get, you just mention it here, right? So that's the main thing. Or we can go with CBT. That's it. Treatment for GAD, treatment of depression is same only, right? If symptoms persist or worsen, we can consider giving the medication as well. What medication? Antidepressants. We will first explore non-pharmacological option. I'll arrange a follow-up appointment to monitor your progress and adjust the plan if needed. So what is the first thing you're doing? Is a lifestyle management and CBT. So what's the difference between GAD and depression? Both are kind of a lot of symptoms are same, overlapping. Depression, 2 weeks history. For GAD, I need long history, maybe 6 months history. Depression, more of low symptoms. Here is more of anxious anxiety because of some work and all. So that is a slight difference between these two things. Management is kind of same if you see in general anxiety disorder or GAD. All right.